America is the only developed nation without universal health care. A reform was drafted as early as 1850. At that time, President Franklin Pierce vetoed a national mental health bill, effectively severing government intervention on health care, using the grounds that one's health should be a private matter. Before President Obama, there were 7 American presidents, including Theodore Roosevelt, Franklin Roosevelt, Harry Truman, Lyndon Johnson, Nixon, Carter, and Clinton, who attempted partial or complete health care reform. The reform process is as difficult as a slow crawl through thorny vines. It was only until Obama became president did the reform receive any progress. On March 21st, 2010, in a midnight vote, the House of Representatives passed the bill with 219 votes for and 212 votes against. The bill officially became the Health Care Reform Act, better known as the Affordable Health Care Act. After President Obama signed the bill, all across America, 23 million uninsured Americans now became covered. Following the Obama health care policy reform, Tunghua Hospital also focuses on providing affordable health care. And the new medical building is perfectly set up to service the Chinese community. But despite the fact that healthcare reform is tremendously favorable, Tunghua Hospital still had many difficulties to resolve. I'm Yalek Huang, news reporter and anchor at KTSF. In the next half hour, we'll learn about many of the new challenges Tunghua Hospital faced. This program is a co-production between KTSF Channel 26 and Chinese Hospital. April 18th was the grand opening of the medical building, but the alley near the building also had a name-changing ceremony at that time. The name of this alley is now Rose Pak's Way, named after the fundraiser board president Rose Pak. But Rose Pak, who was recovering from an illness in China, could not make the opening ceremony.
You couldn't even speak to Rose Pak unless you started with a contribution to the Chinese hospital. Then she would talk to you. And by the way, if she noticed that your contribution was not very big, you had to enhance that contribution. Otherwise, she talked very badly about you. For one purpose and one purpose only, to see that forever there would be the opportunity for people who needed health care, who had a language issue, who needed sensitivity on the cultural side. You could get it right here in San Francisco.
Rose Pak's connection to Tunghua Hospital started in the 1970s. Rose worked as a reporter at the San Francisco Chronicle. She was responsible for reporting on news relating to Chinatown. She saw that the only hospital for the Chinese community was being forced to shut down due to building codes, so she spearheaded a plan to save it. The explanation at that time was that our building was too old. The staircases needed to be 3 inches wider so the patients could be carried down in case there was an emergency and the elevator was out of service. So I said, no way. My hospital has to shut down because of 3 inches on a staircase? Rose sought help from House Representative Phil Burton, and Burton offered a deal. If Rose could raise $3 million within 6 months, that would prove that Chinatown indeed needed its hospital. At that time, the average immigrant worked at a salary of $25 per month, all hard labor. They worked in terrible conditions. I had to ask myself, how could we let our hospital become obsolete? To build a new hospital would require $160 million, and Rosepak went everywhere to gather that money. She had radio telethons, charity golf events. With all the medical employees chipping in and many, many small fund sources, every nickel and dime mattered. What touched me most is that every year when I go out fundraising for the hospital, there are these older gentlemen and ladies. They would come in every month to give $10 or $20. So I spoke to the execs of Tunghua Hospital. No matter what the amount is, we have to write some kind of receipt for these donations. And we will write a letter with the receipt. I don't auto-sign the letter. I don't use stamps. I sign every letter myself. It doesn't matter the size of the donation. It's not about how much you give. It's about being part of the big picture of Tunghua Hospital. Tunghua Hospital is San Francisco's only remaining independent citywide hospital. Of the $160 million needed, 1/3 came from hospital funds, 1/3 from bonds, and the remaining came from community donations, many of them small sums, showing us how much the community cared about Tunghua Hospital. Since the 1980s, Tunghua Hospital, CCHCA, and CCHP have worked together in providing the sick with affordable health care. Although the partnership worked for decades, this relationship broke down in 2015. On August 12, 2015, CCHCA held a press conference in Chinatown, announcing that they had filed a lawsuit against CCHP with the California Supreme Court. The reason was that CCHP was a nonprofit organization, and the lawsuit stated that CCHP management made deals in secret with CCHCA members to gain control over all the physicians. They claimed this would cause individual physicians to lose their independence. It would put Tunghua Hospital and the Chinese community healthcare system in jeopardy. CCHP management pointed out that asking doctors to sign contracts complied with Obama's Affordable Health Care Act. On June 14th, the Tunghua Hospital Board of Directors announced that CCHCA and CCHP were terminating their partnership. A new contract started in July, and a 30-year-old partnership was now at an end. Mrs. Lin, a member of CCHP, immigrated to the U.S. from Hong Kong 30 years ago. At that time, she did not know English at all. She did not know Tunghua Hospital existed. So she had her baby at San Francisco General. Every hospital has their difficulties. When I first came to Chinatown and gave birth to my son at San Francisco General, I felt so helpless because I didn't understand. There was no one there to help translate. Tunghua Hospital gave me a sense of safety. Later on, Mrs. Ling opened up her own restaurant in Chinatown. Now every family member and employee is covered by CCHP. My restaurant is in Chinatown, and all my employees are Chinese. I employed my workers because I want things to be convenient for them. Tunghua Hospital is very convenient for us. They speak Chinese, and they are able to accommodate my workers and
各
me.
方面咧，即係可以配合我啲工人同埋配合我。
Mrs. Lin's primary doctor, who she had for decades, left Tunghua Hospital during the conflict. Her doctor advised her to leave CCHP too, but Mrs. Lin decided to stay after much deliberation. The reason was because she couldn't find the same services offered by CCHP anywhere else.
佢啲醫生要去到
I'm a bit older, so I need a hospital that's easy to travel to. Also, the hospital has to understand my own language. If I have to go to another hospital, if my kids have to work, they can't come with me. Us old folks have to choose a hospital that suits our language.
唔一定跟到我噶嘛。
It's true, there are translators everywhere nowadays, but it seems like they always take forever to come.
方便議員嘅醫院，
Other hospitals have only 1 or 2 translators, and that's not very convenient.
係好耐嘅。
Tunghua Hospital, however, is different. It's a hospital owned by the
華
Chinese.
醫院俾我哋嘅咧係
There is no pressure on me.
同埋我哋覺得呢間係中國人醫院咧，我哋個心咧入到去咧，即係冇一種壓力。
When CCHP and CCHCA terminated their cooperative relationship, the doctors who left joined AAMG. The doctors who stayed with CCHP and Tunghua Hospital created the Jade Healthcare Medical Group.
我希望咧，我哋嘅醫院會係
I believe our hospital can compete with other large-scale hospitals in the Bay Area,
灣區嘅大
whether it is service or medical equipment or patient
醫療
results.
嘅設備，或者我哋係
And I hope that this will bring more Chinese patients to our hospital or seek out help from our doctors.
因為咁嘅話咧，我哋可以多啲華人咧嚟
It makes me proud knowing that I'm part of this.
醫佢。
Everyone should have a sense that they belong.
有一種驕傲
You can't just look at it like I am patient 1, 2, 3, 4, and now I'm going to this hospital to do this
係
procedure.
其中嘅一份子，即係大家要有一種覺得你係屬有一種屬有歸屬。
It should be more like, this is my favorite place.
係因為
I'm going in to do a checkup.
2、3、4
And when the checkup is done, the doctor will explain everything to
差
me.
唔多呢個係我
My body feels better.
嚟嘅地方，我去
I feel like I contributed to the hospital
我醫生
and to the
解釋
Chinese
我係
community.
覺得我自己身體好咗，亦都我覺得我係貢獻咗俾呢個醫院，同埋幫咗呢個醫院，同埋幫咗華人嘅社區。
During the 1930s, the Great Depression was at its height. Franklin Roosevelt signed the Social Security Act in 1935 and created Social Security insurance. So when 1940 came along and World War II, many Americans went overseas to fight, and there was a great need for a greater workforce in America. Employers used healthcare benefits as an incentive to attract workers. This was the beginning of employer-sponsored healthcare. Without employment health insurance, one had to pay out of their own wallet or they wouldn't be able to see a doctor. But as the cost for medical services continued to rise, Congress passed an act in 1965 which set up medical service for seniors over the age of 65. This is what we know as Medicare. And when Obama's Affordable Health Care Act passed in 2013, everyone was required to have health care. And all insurance companies were required to accept people even if they had pre-existing conditions. Everyone could be insured either through the state health care system or the established insurance exchange market. Low-income individuals could receive government subsidies for insurance premiums. The insurance platform created by the California state government is called Covered California. CCHP collaborated with Covered California.
I mean, it is San Francisco, but we also know that the population we serve may not be, low enough that makes to be on Medi-Cal, but also qualify for subsidies. And if we're not careful, and if we're not on the exchange, they're going to fail to see, they're not going to be able to see the same doctors or the hospital again. So we fought really hard to make sure that we were a health plan that was offered onto the exchange.
Established in 1986, the primary focus of CCHP is to service the Chinese of the Bay Area. After the establishment of the Affordable Health Care Act, CCHP became an option under Covered California. Membership in CCHP increased dramatically, and today CCHP has more than 27,000 members.
The Chinese have moved from less than 10% of our population here just 20 or 30 years ago, to nearly a third of San Francisco. This is a major market, and there is the opportunity that I think a number of other groups are looking at in terms of serving this population.
The operations manager of Tonghua Hospital says, under Obama's health care reform, many people who did not have health insurance are now insured. But whether or not these people can receive medical service in time is the key point. Many people have to wait a long time to see a doctor, especially to see a specialist. Sometimes they have to wait 3 to 5 months. If you have to wait that long, your condition would probably be worse by the time you got to the doctor. I believe this is something that must be improved on, to let a patient see a specialist in a timely manner. This is one aspect that the entire healthcare system has to improve. We at Tonghua Hospital, of course, are also trying very hard to improve on this. John Zhang recalled that her entering of Tonghua Hospital was an intervention of fate. At the time, she was getting her master's at UCSF. Her professor advised her to do a fellowship at Tonghua Hospital. At that time, she didn't even know Tonghua Hospital existed. Back in the 90s, Tonghua Hospital was very different from what we are now. At that time, I remember there were many services and equipment prevalent in other hospitals that we did not have. For example, free breast cancer examination was one of them. At the time, we were still more of a community hospital, and we did not have a budget to carry this service. At that time, I thought to myself, I can make a difference. Most of the medical funding in this country is spent to remedy chronic and serious diseases due to an aging population. Tonghua Hospital is no exception. Therefore, we all agreed that there had to be better health education for the Chinese community. Most of the medical funding in this country is spent on serious diseases. In contrast, preventative health care and health maintenance cost a lot less money. If we want to change this phenomenon, we must have a centralized health care system. You have to have the hospital, the health care plan, and the doctors all working together in unison. That is the only way for us to survive. Due to its mission, Tonghua Hospital seeks doctors who are bilingual. A great impact on Tonghua Hospital is that it's very difficult for us to find doctors, especially bilingual doctors. We do this all year long, trying to find good doctors to hire. Everyone knows this. Kaiser is doing exactly the same thing.
Other hospitals may be more appealing because they have parking, free parking or subsidized parking for the employees. We don't have that. So that's going to be the biggest challenge. And furthermore, the staff needs to be tuned towards the patient base. A lot of the patients only speak Chinese, whether it's Cantonese, Mandarin, and so on. So you need to have that staff. That's harder to find.
But I think the first primary goal of Chinese Hospital is to see that the Chinese in San Francisco are able to receive care. And that is not just at this hospital, but that it should be able to receive appropriate care by way of either its clinics or by way of its own medical staff, private providers.
As more and more members moved from Chinatown into other communities, Tonghua Hospital began to set up clinics in different communities. The Wahong Clinic in the Sunset District was the first extension. and the latest addition is the Daly City Outpatient Clinic. Tunghua Hospital now serves more people of different ethnicities.
更多不同嘅族群。
就係我哋已經開咗好多以前我哋叫
We used to be called a dispensary. Now we are calling them clinics. And we have many of them, 5 in total. And we have one called East-West Clinic. We call it Back to the Past. There are a lot of foreigners looking for Eastern medicine. They believe acupuncture is useful. So naturally, there is no reason for us not to have it. I mean, we have always done it. And every foreigner who comes by seeking medical treatment believes that we do great Eastern medicine. So we opened East-West Clinic. Why? It's because our clients are no longer limited just to Chinatown.
我啲僑民已經唔係限於喺即係中國城啊嘛。
咁由於我哋嘅服務啦，
Compared to a lot of other insurance plans, our fees are a lot lower. It's a lot more affordable. And because of this, we've had a great increase in non-Chinese speaking members.
咁所以咧，我哋就喺呢一方面咧係增加咗好多一啲非中文嘅會員。
As the Chinese population in the Bay Area continues to change, healthcare options for the Chinese community continues to increase. Some ask, what is in store for the next century?
不能把它只是当成一个医院。
You can't just look at it like a small hospital. It is a landmark for the Chinese community. This hospital is an integral part of Chinatown. I mean, it's been here since 1925. I believe it is the most important thing in our cultural legacy.
我觉得还是最重要的是我们的文化遗产。
已經去世嘅白蘭
40 years ago, Rose Pak mentioned that the land in Chinatown would become very important. She said when the Central BART station is finished, it will become so much easier for everyone to come to Chinatown. So even 40 years ago, Chinese organizations began to discuss how to protect the existence of Chinatown.
華埠嘅存在。
40幾年前，華埠我哋
40 years ago, some young Chinese folks and I discussed one topic in particular, the future of
中
Chinatown.
國城唐
I persisted at that time that Chinatown would become more important, and Chinatown will become much more needed.
我哋華埠會更加
Tunghua Hospital is the important part of protecting the health of Chinatown,
係保，
and it will become much more important in another century.
所以呢100年後呢就會更加需要。
2016年
On October 8th, 2016, the chief physician, board members, executives, doctors, and nurses of Tunghua Hospital accepted the first patient into the new hospital building.
醫院正式啟用。
This is the milestone of bringing the first patient into Chinese hospital.
回顧
To review the 100-year history of Tunghua Hospital, we start back in the 1900s. Established in 1899, it helped the Chinese diaspora who were discriminated against with much-needed medical services. The long and tumultuous history of Tunghua Hospital brought the hospital to the brink of closure many times. The 1906 earthquake seriously damaged Tunghua Dispensary. The hospital, built in 1925, failed seismic building codes in 1979. Many times, the hospital has faced closure. But with the unification and undaunting perseverance of the Chinese community, not only was Tunghua Hospital saved, it was rebuilt in 2016 to become a brand new medical center, continuing the legacy of over 100 years.
延續100年業績。